Hello everyone, this is Group 1's presentation on Agency for Healthcare Research and Quality, AHRQ, covering health literacy. Members of Group 1 consists of myself, Isabella Balderas, Deborah Benson, Samario Blanco, Charles Bonner, and Heriberto de la Fuente. The Agency for Healthcare Research and Quality is a federal agency. They're in charge of improving the safety and quality of America's healthcare system. They also develop knowledge, tools, and data needed to improve healthcare. Their mission is to produce evidence to make healthcare safer, higher quality, more accessible, equitable, and affordable, and to work with U.S. Department of Health and Human Services and with other partners to make sure that the evidence is understood and used. AHRQ's website can be found at www.ahrq.gov. Here you can look at resources as far as what they do, their missions, the programs they oversee. Health literacy occurs when health information and services are created for the public and help people find, understand, and use these services. So AHRQ, they provide resources to help healthcare professionals and delivery organizations make information easier to understand for the consumer or patients and makes the system easier to navigate. Some of the tools that healthcare professionals, delivery organizations, and systems have access to on the AHRQ's website are listed here. So you have pharmacy, health literacy centers, re-engineered discharge toolkits, healthcare innovations exchange, also links on how to help patients engage in their own healthcare, also talking about the translation of data into information, and just an overall engagement of the patient to know what information is out there for them to access.